How's it going? I'm Michael Nichols,
And I'm John Reed.
and this is a presentation on heart conditions. So what is the heart? The heart is an organ that pumps blood through the circulatory system. What are the four chambers in the heart? You got the right atrium, the right ventricle, the left atrium, and the left ventricle. And as you can see here, this is where it would be at in the heart. So the right atrium, it receives blood and sends it to the right ventricle. From there, the right ventricle sends the blood to the lungs where it's given oxygen. The left atrium receives the blood from the lungs and sends it to the left ventricle. And then the left ventricle pumps the blood to the rest of the body.
Some of the common heart conditions, such as coronary heart disease, congestive heart failure, arrhythmia, aortic aneurysms, and heart infections. Coronary heart disease is when bad cholesterol, LDL, builds up in the heart arteries, as you can see in this picture. It'll narrow the artery with plaque. Symptoms include chest pain, shortness of breath, and fatigue. Congestive heart failure is when your heart is pumping at a low output or it is pumping at too high of a pressure. When it is pumping at too high of a pressure, fluid may be present, and legs and ankles will begin to swell, or could swell at least. Symptoms, most common is the shortness of breath, dizziness, pain in chest, and cough. Arrhythmia is the heart beats irregular, either too fast or too slow. Symptoms, there may be none at all, but if they are, it'll be dizziness, fainting, fluttering in chest. Aortic aneurysm is blood vessels that carries blood to the rest of the body get swollen or enlarged by the inherited diseases. Symptoms, pain in the back and legs, nausea, vomiting, or low blood pressure. Heart infections such as TB or viruses and other infections can swell the sac the heart is surrounded by. And symptoms include dizziness, pain in chest, and sweating, but are not limited to.
Now we have some heart tests such as electrocardiogram, echocardiogram, cardiac stress test, cardiac catheterization, Holter monitor, and vent monitor. Electrocardiogram is when that traces the heart's electrical activity. Echocardiogram is an ultrasound that provides direct viewing of any problems involving the heart's pumping ability and valves. A cardiac stress test is running on a treadmill to get the heart to pump to its capacity, as you can see in this picture. Cardiac catheterization is when a catheter is inserted from your groin to the heart to view X-ray images of the arteries to perform procedures. A Holter monitor is a portable heart monitor that records the heart's rhythm continuously for a 24-hour period. An vent monitor is a portable heart monitor to, at a push of a button, records the heart's electrical rhythm.
Treatments include exercise, angioplastia, lipid-lowering agents, aspirin, pacemakers, and diuretics. So angioplasty is doctor puts a balloon in a narrowed or blocked artery and inflates it, and then a stent is put in to keep it open. As you can see here in this picture, they insert the balloon and they insert it, and then they'll put the stent in. Lipid lowering agents lower bad cholesterol. With lipids breaking down agents helps lower risk of a heart attack. So also aspirin acts as a blood thinner and helps blood from clotting in a narrowed artery. Pacemaker sends electrical impulses to the heart when needed to keep the heart at a normal beating rhythm. Diuretics, increase water loss and urination to help with congestive heart failure symptoms to fluid buildup. And here is our works cited page. And thank you for your time, Mr. Moore.